This is a video demonstration of the deep dermal surgical stitch. You must first mount the needle in the correct position on the tip of the needle driver, a half to 2/3 of the way from the sharp tip of the needle. When you load the needle, you load it at a 45-degree angle from the perpendicular line of the needle driver. When you hold the needle driver, it is customary to place your ring finger and thumb inside the rings of the needle driver. The pointer finger remains straight along the shank and serves as the fulcrum to direct the needle driver when supinating your wrist. If necessary, you can palm the needle driver as shown here. The rings of the needle driver are now placed in your palm, but the pointer finger still stays straight along the shank to direct the needle driver. The forceps are utilized to evert and present the tissue to the tip of the needle, which is driven at a 90-degree angle directly into the tissue. You begin by pushing the tip of the needle deep into the left side of the incision, entering deep in the dermis and exiting superficially right below the epidermis. Never grab the tip of your needle with your needle driver, as you may bend or break the needle. Pull the suture through so your tail is shorter and easier to handle. Using your forceps, evert the skin on the right side of the incision to present the tissue to your needle driver. You will drive the needle into the tissue, this time entering superficially directly below the epidermis and exiting deep within the dermis. You will need to ensure that you are bringing the correct layers together by entering and exiting each side of the incision at the same depths. Before you begin knot tying to secure your deep dermal stitch, ensure that the loop is on one side of the two free ends of the suture. In this case, the loop is pulled towards the surgeon and the two ends of the suture are away from the surgeon. This step will ensure that the knot will bury within the incision. You should also protect your needle prior to laying it down. You then tie down the stitch with a surgical knot, most often with the one-handed square knot technique as shown here. The number of knots you throw depends on the type of suture. Notice that in this case, you will lay down your knots with your hands alternating in parallel with the incision instead of perpendicular to the incision in order to bury the knot. Cut the suture ends directly above the knot without disrupting the knot itself.